So I'm really glad to have you here, Sandra. Thank you for joining me.
You're welcome.
So, Sandra, you and I met in an unusual way. We were at a financial conference.
Yes.
And we were in another country.
Yes, actually, yes, we were, weren't we?
Yes, and if I remember right, we sat down at the same table and then found out that we only live about 25 minutes apart.
Yes, I thought that was very interesting. We had to go to Mexico to meet each other when we should have. Maybe had lots of connections here that we should have met earlier.
Sure. Maybe it was the right timing, but I was really impressed with you and your husband and the work that you guys do on Medicare. I know that you travel around to a lot of cities doing presentations to large groups at community centers and colleges.
Yep, and libraries. Mm-hmm.
And I know that I've been to a couple of them, and they're great. People love it. And, the reality is we hear these words all the time, Medicare, but sometimes that doesn't really resonate with anyone. They don't know what Medicare is. They know vaguely what it is, but really what
Or they think it's something so far off they don't need to worry about it until later.
Yes. Yeah. So in basic terms, what is Medicare?
So Medicare is health insurance, right, for people who are over 65 primarily. It could be for people who are younger if they're on disability, but primarily for people when they turn 65, they go on to Medicare. Or you can delay it, of course, if you're still working. But it takes the place of your employer's plan that you have had all your working life. So it's just basically health insurance, right?
Right, and it is a benefit to anyone that turns 65. Do you have, as long as you're a U.S. resident? What about if you're not, or if you're live here?
So you have to have worked in the system long enough to have got 40 credits, is what they call them. You can look up on the Social Security website. You can have a login on that, and it'll tell you how many credits you have. But you have to have 40 to be able to get Medicare without any. Actually, it's to get Part A without any premium. But people can get both of them as long as they're ready to pay a premium if they haven't gotten the full credits too.
Well,
so it's for anybody.
One of the reasons I bring that up is because I know an individual who worked here in the United States. They came here as part of a nursing program and then moved back into another country, a country which provides medical insurance.
Okay.
But for certain procedures, they still come back to the United States to use Medicare.
That's interesting.
Yeah, but they're not U.S. Well, she's not a U.S. citizen.
Right.
So, and so Medicare. Let's break that down. How does somebody start to enroll, and what
so
do they?
You have to remember. So Medicare is like a big word that people get a little confused by. They're not sure exactly what that means. They hear a lot of different parts and pieces and letters and ABCs. That's why I call my presentation the ABCs of Medicare, because it gets convoluted somewhat. But Medicare basically original Medicare is the framework. I like to think of it as an umbrella, this framework of this coverage that you have. And so that's broken down into actually 4 parts, but the 2 that people are most familiar with are Part A and Part B. Part A is primarily for hospitalization, so covers if you have to go into the hospital or if you have to go to a skilled nursing facility after a hospital stay, and that's what it covers. That's basically it. And then Part B covers a lot of the other medical expenses: going to the doctor, going to the lab, if you have an emergency room visit, or have to have X-rays, things like that.
Okay.
So the rest of that is covered by Part B.
It seems like that encompasses most medical costs right there,
yes.
Part A and Part
yes.
B. So you have your hospital, if I understand this right, the hospital has their costs, and then you have other costs like the doctors and the emergency
right.
services.
Labs, all that kind of stuff.
Yes.
Yeah.
And so they break it into 2.
Into 2.
So some people might really ultimately need both of those, right?
Yes, you have to have both of them in the end. Yes,
okay.
It's required. So the difference, people start to get worried. I think it's actually, what's interesting to me is how frightened people are by Medicare. And I think it's because we tend to get so worried about something that we don't all the way understand. And they've also got this feeling in their mind, if they don't do it correctly, they're going to get penalized, and they'll be penalized the rest of their life. So there is penalties involved if you don't sign up for A and B at the proper time. And so that's one of the things you have to remember. There's an initial enrollment period that is to do when you turn 65, 3 months prior to your birth month, and 3 months after your birth month, that you have that enrollment window to sign up for A and for B. What we get a little confused by is that people do not have to sign up for those if they are still working and covered by their employer plan. So if you're still covered by your employer plan and you want to stay there, that's fine. Especially if your employer's really good and has paid, a lot of the cost of it, right? So there's no need to sign up for something that's going to cost you money if you don't need it.
What if your insurance at your current job isn't that great?
Then that's the thing we talk about with people. My clients, I sit down with them and we talk about, okay, let's say this for sure. A is premium free if you've had your 40 credits. So that is one that I'll tell people go ahead and sign up for that unless you are have an HSA account that you want to still contribute to, because that affects that. B has a premium involved, and that's based on your income. They look back 2 years to find out what they'll charge you for that, and Medicare decides how much they're going to charge you based on your income. So we look at the cost of that, plus the additional insurance you'll need to cover whatever Medicare doesn't, and then we compare it to what you're paying for your health insurance through your work. If it's less, there's no reason to take something that's going to cost you more. It's got really good coverage, Medicare does. So it's kind of a balancing act we have to go through to see what's covered and what's not.
So you brought up that you do have to apply, generally speaking, unless you have something, other coverage. What happens if you don't apply at age 65?
Right, so if you don't apply in your,
you should.
And you should, yeah. So if you are not covered by an employer plan, or because it could be your employer plan or it could be your spouse's employer plan that you're covered by. As long as you're covered by a credible coverage that's as good or better than Medicare, you can defer signing up. But if you're not, and you don't sign up, then there is a penalty involved when you go to sign up.
There's like a police SWAT team that comes to your house.
Yeah, right. They break in and knock down the door.
You need Medicare for this injury.
No, it's when you start to apply. Then they'll say, "Well, you should have signed up long ago," and so there's
a penalty.
Yeah.
Yeah, and I mean, at first, when you first hear that, you're like, a penalty for not using a government service, but it is a pool of people, right?
Right.
And just like anything government, when you have a pool of people using the same benefit, you need other people to pay into it.
Right.
And you just can't have people who are saying, well, I'm healthy, I don't need anything, not putting into it. But there is a premium you pay, and you were talking about how that depends on your income. So is it like a kind of percentage scale, or how does that work exactly? Yeah,
they have a breakdown, and I don't know. You don't want to go into that specifically, do you? That's
I'm just thinking that most people, from what the numbers I looked
at. Yeah, for most people. So basically, it's again based on your income, and it's tied to your tax return. So if you file jointly, it's based on an amount that's under $206,000 is the lowest amount, and then if you're individual, the $103,000 is the lowest amount, and that equates to this year a premium of $174.70. So every year Medicare decides if they're going to change the premiums or not. So that's a number that's movable. Actually, I should go this way because it doesn't ever really go down.
This is much more cooler though.
Yeah, that's more fun.
So, just like generally speaking, with looking at the average income, unless you're making a couple $100,000 a year, which is not a bad place to be,
right,
you're going to be sitting in the lowest bracket.
Right.
And
that's
so
the 174.
There may be things that you may want to consider when you're taking a distribution to, let's say, pay off your house, or do like buy a car. People say, I don't want to pay with cash. I have the money in my 401k, and all of a sudden now they're paying higher Medicare premium. So it seems like something really to be
you kind of need
to plan it out.
Yeah, and a little bit. Like I've had clients who say, 2 years ago we sold a rental. Oh no. Well, yeah, that's going to affect your premium because
and
2 years ago.
And how long does that affect? How long does that affect your income?
So they review it. Medicare does yearly, I believe.
Okay.
So there is a form too that if you're you have 2 years ago, your income is very different from now. Say, okay, I'm retiring now, because that's something that also happens at 65 for a lot of people. Once they can go onto Medicare, they go ahead and retire. So that means for sure your income's going to be lower now than it was 2 years ago. So
Sure.
they do have a form that you can fill out and file too, to have them say,
this is not my
look back,
income.
look back, my income is not going to be the same anymore, so please look at this income instead.
Okay.
And so they do have that option.
All right, so let's talk a little bit about, so we got Part A and B, and for some reason they decided to divide that, even though you have to get both of them.
You have to have both of them.
But then there's other things that people have to pay for,
right,
like
because
prescription
so
and other things.
so the things that Medicare does not cover, the hospitalization covers 100%, but there is a large deductible per occurrence. So that's something to think about. And Part B is an 80-20 plan.
Okay.
So Medicare pays 80, you pay 20. And that's based on what Medicare decides is a good thing for the
Sure.
doctor to charge, right? So there could be some discrepancy between what the doctor charges and what Medicare is saying is a charge. So you might have even more than 20%. So and Medicare also does not cover dental or vision or hearing aids.
So there's still some incentive to not just, if you're going to be doing some work, usually it's an emergency situation.
Right.
And then you just pay it, but at least you're not paying, $100,000 for a surgery. You might only be paying a couple thousand.
Right. Oh, it's good. I mean, you definitely want the coverage, but
Yeah.
you have to realize that it doesn't cover everything, and wasn't meant to.
Sure.
It was supposed to just be a help. And so there are other policies that you need to get to attach to your overall umbrella, right? So I like to tell people it's like a big umbrella that's got holes in it. So we have to have buckets underneath it to catch the rain that's coming through.
So the next one obviously in line would be Part C, right?
Well, not necessarily.
Hey, I'm just
that's
making
right.
it out
You
the
would
way most
think
people would think
maybe
here.
C, right? The next one that's required is actually Part D for Part Drug.
Mm-hmm.
After they had A and B, they realized, well, this doesn't cover any prescription drug coverage and costs, and that's a big cost for seniors, a lot, right?
Mm-hmm.
That seems to be where people's biggest expense is.
Sure.
And so that's also required, and that one's a little bit different in that I think people, when they first go into Medicare, they say to themselves, well, I'm really healthy, I'm not taking any prescription drugs, so I don't really need a prescription drug coverage, so I'll just wait and get that later. But you don't want to do that, because there's a penalty attached to that part as well if you don't sign up at the right time. And I think it's worse than the one for Part B, because Part B is a one-time penalty, but Part D, if you don't sign up for that properly, they assess you a percentage of what you should have paid and attach it to your premium the rest
But
of your
it is
life.
elective. Part D is not something you have to get.
No, it is. You have to. It's required.
Okay.
It is required, yes. And if you don't get it, when you do, they'll penalize you.
Okay.
Yeah.
And is that extra money then?
Yeah.
Yeah. Okay.
Yeah. So A and B is original Medicare, and it's what it is. It's just what Medicare says it is, and you take it or leave it kind of thing. Well, you can't leave it. And then, but Part D is covered.
You take it or take it.
You have to take it, but there are lots of choices. So Part D is not something that Medicare has put out there and said, here's how you do it. So there are a lot of prescription coverage plans that are by a whole bunch of different insurance companies.
Mm-hmm.
So you just you can go onto the Medicare.gov website, and there's a place where you say, let me see what Plan Ds are available in my area, and you plug in your zip code, and you plug in all your prescriptions, and it'll pop up which plan is going to be the best for you in your area. That's something I help my clients with, because it can get a little bit confusing and overwhelming on trying to figure out which plan is the best. But they do have ones based on, some are much lower premiums. If you're not going to use it a lot, then there's plans that are very inexpensive for people who are still pretty healthy.
If only there was like somebody to help guide you through all this.
Yeah, I think that's the thing that's the most frustrating to me, and why I do what I do, is because I think it's really sad that there is a required program that there's no one to help people do. Because Medicare people are not allowed to give you advice, right? You can call Medicare and they'll tell you what it is, but they can't give you an advice that's helpful to you, really. So
So, tell me about the clientele that you currently work with. They're this area, they're Sacramento, they're the Bay Area, but it isn't anyone that pretty much has the ability to call you.
Yeah. I don't have a problem with talking to anybody that wants to reach out and chat with me
So
about
somebody finds this podcast and they're in, Little Rock, Arkansas. They can call you and you can help them.
Absolutely.
It's not state by state.
No, Medicare is the same everywhere. The plans that you'll be able to have access to are going to be different based on your zip code, but that's something I can totally look up and help you. Yeah,
okay.
Always.
And do you do Zoom?
Yes, I love Zoom.
Okay, and Zoom is helpful because you have some visual aids to show.
Right.
And help people. So we've covered the, A, B, C, and D.
We didn't cover Z.
Okay, so there's obviously more to it.
So there is.
Okay.
There's you're going to have your required A, B, and D, but then there's a whole lot of stuff that's not covered. And so there are Medigap plans, that's what supplemental insurance is called, or you have the option of doing an Advantage plan, which most people are familiar with because that's what gets advertised the most on TV. Because those you can change every year. You can change your mind about those. And so those people are most familiar with because they see the ads around October 15th to December 7th, where they're encouraging people to look at their plan and see if they need to change them.
So does the government pay you? How are you able to financially to help clients?
No, I am not affiliated with Medicare. I'm not affiliated with the government anyway. I am an independent insurance agent that specializes in Medicare insurance. So the things I do for my clients, just because I feel like it's really important that they have this help, is I will sit with somebody one-on-one, Zoom in my office, on the phone, however, and talk about their situation. My biggest concern, I think, is I don't want somebody to make a decision that then they worry about for the rest of their life, or every so often, or every end of the year when those ads start popping up and they start worrying, am I in the right place and am I doing the right thing? So we want to sit down and talk about everyone's situation is so different, right? Even though there are some things that are global and it makes sense that we need to talk about them in general, everyone has a specific situation that's unique to them. And so I want to sit with them and talk about what they need and how they perceive what they feel about their insurance. What's important to them? Is the most important thing to them the cost, or is the most important thing that I can go to the doctor I want to? Can I be in charge of my Medicare medical expenses, or do I have to get permission? These are things we need to talk about. And then once that's figured out and we get them signed up for A, B, and get that all taken care of, then we'll look at the different other insurance products that are available that they do have to attach to their A and B. And those, I'm appointed with a lot of different insurance companies that provide those plans, and if I can find a plan that works for them that I'm appointed with, I'll get a commission from that company. And I'm happy to do that. If it's something that I'm not appointed with and they still want it, I'm happy to help them get signed up with that too, because I think it's
so
really
if they use you, they might end up paying more than if they call the company
No,
directly?
absolutely not. It doesn't cost them a thing. No. The nice thing about it is that the insurance company doesn't take my commission out of their pocket at all. They pay exactly the same whether they pay the same whether they go through me or they call up or get online with the company themselves.
I know there are do-it-yourselfers out there, and there's nothing wrong with that. I say all the power to somebody who wants to try. But what kind of mistakes do people make that you've seen in applying for Medicare?
Not considering what their situation will be down the line, I think has a lot to do with it, or just grabbing one because it's what they've had before. A lot of people say, well, I've been with this company, so I'll just stay with them. But what they don't realize is Medicare is a total different, it's a total different animal. It's a different thing than just regular, I'm lost my train of thought, employer plans. Employer plans are very different from Medicare. So even if I had a plan with A, B, C company and they have a Medicare product, and so I'll just go with them, it's going to be different insurance because it's going to be what's covered by Medicare now. And usually they're totally different people that you'll be dealing with in the back office. So I think that has a lot to do with sometimes people think they're going to get the same coverage that they've always had because they've stayed with the same insurance, and that's not the case. They're moving it over to
part of just a thought that I had is that somebody works at a job with a really good insurance plan, and they say, oh, I'll just keep that same insurance, and then realize that, shoot, that company was paying a lot for that insurance, and I don't know if I can afford that.
Right.
Or they don't realize how much it's going to cost until they, there's no looking ahead of time. But you can generally price out and find something similar to what they have, but maybe less expensive.
Yeah, and again, you're not going to have access to those plans once you leave the job, for the most part. And so Medicare is it's like having to find a whole different insurance company. So people, they need to realize that. And then too, I think that people forget that we're in a different situation now. Medicare is a total different thing, and we need to look at it differently. I have to be aware that I have to have my A and B, but I have to have a supplement or an advantage plan to go with it. I for sure have to have a prescription plan. You also have to realize that you need to look at them yearly just to make sure you're still in the right plan for you. And
so you do an assessment for people, but I want to back up just a little bit because we use the word supplemental, and I know that's been brought up once, but maybe we could dive more into what does that mean, supplemental? I mean, obviously the word is obvious, but what does that mean as far as insurance?
So
I mean, you have A, B, do you get A plus?
That would be good, huh?
How does that work?
So you've got your A and B that's required. You have to have that, and that's the basic foundation of what Medicare is coverage. And then they realized, there's lots of things that are not covered, so especially like the 80-20, right? So I kind of look at it like Medicare came up with this idea of, okay, let's offer supplemental insurance to A and B, and let's call it Medigap. So that's a lot of people are familiar with that term, that it's called Medigap insurance. And those are plans that are regulated by Medicare. So they've laid them out. They said, here are these plans that we want insurance companies now to go ahead and say how much will it cost to offer these plans to people. The confusing part is that they've named them alphabetically. So they're plan A, B, C, D. So that's where people get confused. They're like, oh, I already have my A, B, and I already have that. No, actually you have part A and B. Now you need to find out if you want plan A, B, C, or D, right?
Okay.
So those are the supplemental plans. They are the same in whatever state you're in. So that's kind of nice. If I'm choosing a plan G, it's going to be a plan G, no matter where I am, whether I'm in Arizona or Arkansas or California. The price might be a little bit different based on where you live, but the coverage is exactly the same. So that's the nice thing about supplemental insurance, that did you know exactly how much it's going to cost you? It doesn't. There is a deductible attached to it that changes yearly from Medicare. They come up with that, but once you've paid your deductible and you pay your premium every month, that's all it costs. A lot of them are covered. Cover a whole lot of. Have 100% coverage on a lot of things. So that's one thing to look at. There's also not a network involved with supplemental insurance. I can go to whatever doctor takes original Medicare. So a lot of people like that they have a little more say in which doctors they want to go to.
Especially if you live in a remote area that we
Yes,
do.
Especially if you live in a remote area where there's not doctors around. You want to be able to go to whatever one you want to go to, right?
Yeah, it's something like calling doctor after doctor.
Doctors say, do you take this plan? No, I don't take that plan.
But just to back up for a second, you talked earlier about a plan Z, and so does it go all the way from plan A to Z? Is there 26 plans?
No, I'm sorry. I think I meant to say plan C, but no, there are A through N plans that are supplemental plan, and they have different ones with different coverage. So I think they did that because when they first came out with, there was no other option, and so there was a price difference on ones that had less coverage than ones that had more. Okay. I think if someone's looking at a supplemental plan, usually that means that cost is not their first priority. It means that having control of their health coverage is a little more important to them. And so I recommend people go for a plan G, which is the one that has the most coverage, has 100% of most of everything. Doesn't cover your Part D, B deductible, but it covers 100% of everything else. So that means if I go to the doctor and I've paid my deductible, I don't have any other additional payments. The other option that you have, if that's not something that you want to do maybe because of the price or because I have a plan that I really like and this doctor takes that plan, is an Advantage plan. So an Advantage plan is like, well, they're all exactly like an HMO for the most part.
Okay.
You are in a network. Your doctors have to take the plan. They have to be in the network, so you have to go to where the network covers.
Mm-hmm.
Those are lots less expensive usually per month. But when you do go to the doctor, there's a copay. So
Okay.
You're going to kind of get you coming or going.
Okay, so you have a lot of different options.
Mm-hmm.
Obviously, you really know your stuff. You work with hundreds of clients, I'm guessing, maybe more, and so you've had a lot of opportunities to explore a lot of unique situations. So when somebody calls you, there's no fee they pay, but if they end up signing for insurance, you get compensated by the insurance company, and it doesn't come out of their insurance at all.
Right. It doesn't cost them anything for any of my time at all, ever.
Yeah. So how is it you don't have people busting down your door to the point where you even have time to be here?
I guess they just don't know.
So there's a unique value here that somebody should take advantage before your schedule fills up.
Yeah, I think so. The nice thing about having somebody that you can call is there are lots of options. People can go online and find out all this information. It's not hidden, right? But there are people who just really want to talk to a person in person, right, or on the phone. And like I said, if you call a company about it, they're going to be able to tell you only what their company sells and not anybody else's. Or if you call Medicare, they can't give you advice. They can't really even tell you what plans are available for you. So the people who really want to be able to talk to somebody, that's where my little niche there. So I'm with people who really still want to have an in-person kind of a contact about it rather than feel like they're comfortable doing it online.
Sure. So, words of advice. What would you say that someone should be careful of? Is there potential scams out there on Medicare? What do you need to...
There are people that will call you, and you shouldn't actually be getting random phone calls because Medicare doesn't really allow that. So if people are calling you, that's probably a red flag right there. What happens a lot, I think, is that they get calls or they'll get emails or whatever that are a little scary. Like, if you don't do this, you're gonna get penalized if you don't do this at the right time. They say, we can save you a whole bunch of money. You need to go to this plan instead. And what they don't tell people is that plan doesn't cover the same things as what they've got. So I always tell people, if you get a call or you get something, talk to me. Just call me and say, is this something that's real? And I'll tell you.
Okay.
If it's something that's better for you, then definitely we'll move you to that better plan. I mean, I'm all about making sure you have the best coverage for your situation. That's the bottom line. It's not about, how much money am I going to make. So if you see something that feels a little wonky or you think this might be the best thing for me, call me and talk to me. All my clients have my number, and I answer the phone all the time.
Sounds good. All right. So, is there anything that we didn't hit that you would like to?
Oh yeah, there's one more thing. There are some changes coming in Medicare that'll be effective in 2025 because due to the Inflation Reduction Act and how prescription drug coverage is going to be handled. So that's something for people who maybe are already on Medicare. They need to be aware that there are going to be changes coming in January of 2025. So in that open enrollment period of October 16th to December 7th, you need to talk to somebody about your prescription drug coverage, even if you have an Advantage plan, because Advantage plans roll prescription drug coverage into them. There's still going to be changes. So definitely everybody who's on Medicare or is going to be going on to Medicare needs to make sure that they check into what's going to be changing this next year due to that.
So we don't have that information yet.
Nope, we're not allowed to talk about it until October 16th.
Okay,
yeah.
But without dating this podcast, because a lot of the information you gave is going to still be true.
Right.
we should do an add-on when
Yes.
October
Yes.
rolls around, and
Right.
update with some of the numbers or information that we're able to share
Yeah.
at that time, because it's a very small window. October, the end of the year. I mean, you take out your major holidays,
Right. Right.
and other activities. There's not a lot of time to get stuff
Yeah.
done.
The nice thing is it doesn't really take that much time. Shouldn't be more than a half-hour conversation for somebody to have.
Sure.
Just what are my prescriptions? What am I on right now? Let me look at if there's any changes to that plan. Yeah, you're still on the right one, or no, we need to move you.
So they should call you December 30th.
No, that's too late.
Okay.
Yeah.
All right. Well, that's some great information, and I think we covered the ABCs.
The ABCs. Yep.
Yep, and
the Ds.
Yep, and the Ds of Medicare. And I think it's been a pleasure having you as a guest.
Thank you.
I think that this is valuable information to put out there for our clients and also for the general public. So if somebody has a question for you, what is one of the ways they can reach out to you?
So they can email me. It's sandra.distefano@bufferinsurance.com. And
Okay,
so we'll
great.
have to put that out. That's a lot of vowels in that one.
All right, it's right here on the screen. Right, am I doing this right? Yes. Okay. Thank you, Sandra, for being here, and look forward to talking with you again when we get those new rules.